Excuse me while I take a drink. All right, so the heart model. These are the parts and pieces that I want you to know. And again, it follows the same pattern as the figure that we just went through. You've got the right atrium, you've got the left atrium, but now you also have these kind of folded ends here that are called the auricles. So if you look at the heart, see that little extra fold of tissue? Hang on. Again, you can kind of see that extra fold of tissue right here. So something you have to understand, with the heart, we're dealing with volumes and we're dealing with pressures. And if for some reason your blood volume goes up, there needs to be extra room for expansion in those atria. So having a little bit like an extra fold of flesh there, an extra fold of cardiac muscle, actually allows it to expand more. Now, why do we call it the auricle? You know how dogs' ears fold over? That's kind of what it looks like. So they named it the left and the right auricle because it looks like a folded over dog ear. So you've got the right atrium, the right auricle. The coronary sulcus is that fold that you see there. Remember I said it's kind of like a groove? You've got the right ventricle, the apex of the heart down here, and then the interventricular sulcus, which again is that groove that sits there. And of course it's anterior. So this is the anterior interventricular sulcus. You've got the great cardiac vein right there. Remember that that's the big vein in the front. You've got the left ventricle. You've got the left atrium. You've got the pulmonary veins, the left pulmonary veins. Remember that the pulmonary veins are carrying oxygenated blood. So when you look at the side here, they're going to be red. Okay, so this is the left side. Those are the pulmonary veins. They're going or coming back from the lungs after getting oxygen. You've got the pulmonary trunk. You've got the left pulmonary artery going to the left lung. You've got the right pulmonary artery going to the right lung. And then you've got this ligamentum arteriosum. So where are you? See right here, this ligament kind of holding this to this? That's exactly what it does. It holds that to that. It holds your aorta to kind of where your pulmonary trunk splits. You've got the ascending aorta, and you've got the aortic arch where it actually starts to arch over. The brachiocephalic trunk, remember on the right side, they've just got the trunk, it doesn't split yet. On the left, you've got the common carotid headed toward the head, left common carotid artery, and then the left subclavian artery is the one that's actually going to the arm. 16 is the superior vena cava. 17 is the right brachiocephalic vein. 18 is the left brachiocephalic vein. These are draining into the superior vena cava. And then, of course, you've got that kind of lumpy, bumpy thing, the left auricle. Now, looking at the heart from the front, kind of like this, okay? So you're looking at it like this instead of like that, okay? Yeah, kind of like that. Okay, coronary sulcus. Remember, this is the groove that these are sitting in. Number 63 is that marginal artery that I talked about earlier. 26 is the inferior vena cava. You've got the great cardiac vein. You've got the anterior interventricular artery. And then, of course, this is the right ventricle. Something that you've got to keep in mind is that those ventricles have to be big because those ventricles are the things that are actually pumping the blood away from the heart and to another location. So having them as the majority of the material of the heart does make sense. Oh, and the apex of the heart down here. Okay, so this is looking, so here's my right atrium. We're looking inside. Okay, that's all we're doing. So, number 31, that's that right coronary artery coming off of my ascending aorta. Okay, number 32 is going to be the Sinoatrial Node. This is one of the electrical bundles in our heart. Number 36 is the AV node, AV, atrioventricular. It's between the atria and the ventricles. Number 33 here is going to be basically the orifice or the entrance of the inferior vena cava. Number 52 is those pectinate muscles I was talking about before. Number 53, see how it kind of smooths out here? This is the cristae terminalis. It's kind of a junction between the wall of the atria and the wall of the vena cava. There we go. The fossa ovalis. This again is that kind of scar that's left behind. It's right there. Okay. And then we've got the opening to the coronary sinus right here. Okay. Now this is the right ventricle. So we're going from looking up here to looking down here. So we've got our pulmonary semilunar valve. These are, again, the electrical fibers called the Purkinje fibers. I'm sorry, these are the Purkinje fibers. This is the bundle branch. This is the right bundle branch because it is in the right side of the heart. The Purkinje fibers are these fibers that are coming up along the base of the heart. The trabeculae carnae, see all of these lumpy, bumpy things? These are the trabeculae carnae, the chordae tendineae, okay, that hold that down. And then we've got our tricuspid valve. The posterior to the right side of the heart, we've got the azygous vein, we've got the right pulmonary artery going to the right lung. We've got the right pulmonary veins coming in from that right lung. We've got the inferior vena cava draining the bottom of the body. Looking at the left side of the heart. So we've been looking here. We kind of went back here. Now we're looking, no, we've been looking here. Did this, then came back here. Now we're looking here. There we go. Okay. So we have the left ventricle. We have the left pulmonary vein. Okay. We have the left pulmonary artery. Wait a minute. Vein, artery. No. Vein, artery, vein. There we go. You can tell I'm having a fantastic day, can't you? So there's the ascending aorta, there's the arch. See how this one is going down? This is now considered the descending aorta, okay? On the back of the heart, okay, we have the left posterior vein. We have the great cardiac vein. We have the apex, and we have where am I getting confused? Left posterior vein, left cardiac vein, great cardiac vein, the circumflex artery. That's what I was missing. I was like, what am I missing? There it is. Remember I said that goes around the circumference of my cell? Or my heart. So this is coming around the side. So here's the front of my heart. See this going around the side here? Okay, that's going to be the circumflex. All right. And that's what you need to know with the model. It is a possibility that I will use some pictures from the model, but it is not a possibility that I will pick something randomly from the model that you haven't seen on the figures that I've just given you. So make sure that you study both the figures out of your book that I've highlighted and this, okay, and your model. Okie doke.